sure that come the end of May, and I think May has come and it has gone, let all the results of the job evaluation exercise come in so that everybody is then placed in their correct grades. In their correct grades. Grades that are quite distinct and grades that also exhibit the relativities in terms of salaries and conditions of service. When we have done that, then we can talk about, is it now necessary for us to come up with a cost of living adjustments? Now we are adjusting something that has been scientifically established as equitable. Now, what is the magnitude of the adjustment to salaries of individuals who hold posts that have been scientifically determined to be equitable and efficient? That is a matter now that constitutes the next stage in this roadmap towards having a cost of living adjustment in any event no later than the 1st of July 2025. So between now, we are bringing in the results of our job evaluation exercises. And we will know that the specialist orthopedic surgeon belongs to either grade E or grade F, right? And in that same grade, it's just a grade for the Ministry of Health and Child Care. In that same grade, you'll be surprised, you might actually also have somebody called a senior lecturer at the University of Zimbabwe. Right? The posts in terms of their functions, the posts in terms of their decisions that you're making, the posts in terms of your skills and competencies, in other words, your qualifications say they both belong to a particular grade. When that has been established, what reason would the chairperson of the Public Service Commission and Health Service Commission have to say, no, but I'm going to pay, the senior lecturer more than the surgeon? I have no basis of doing that. Why? Because the job evaluation exercise is determined that this is the grade to which they belong, and therefore their salaries and conditions of service ought to be the same. But, Chairperson, are you saying you don't recognize the peculiarity and the complexity? That's what I was told this morning. Health services is very complex, it's very peculiar. There are nooks and crannies that one has to navigate through. Nowhere near what a lecturer at the University of Zimbabwe in the same grade in terms of the post would be doing. I'll grant you the point. Those institutional peculiarities and particularities are there. But you know what? We don't deal with those in the context of salaries and conditions of service for people that are actually occupying posts that are in the same grade. The Ministry of Health and Child Care and their staff, that was us here, we go and make our case to say, over and above the salaries and conditions of service that are being paid here, there are these peculiarities that expose our employees to a whole range of risks that have to be paid for. And that is paid for in the context of allowances, not in the context of salaries. Now, that's why you will have somebody say, no, there is night duty, on-call allowance. All those are sector-specific allowances that are negotiated separately.
I'm very happy, and the team is very happy that we have the Health Service Commission in its entirety, coming to interact with the executive as well as members of staff. What is very important is we are from the transition from the Health Service Board to the Health Service Commission. The people on the ground were not very sure what does it mean. Obviously, staff is concerned about conditions of service, and the chair has articulated very well that the currently process of job evaluation is coming to its conclusion, and he has assured us that by end of June that work will be done, and beginning July the implementation takes place. Obviously, some of the concern was this is in the middle of the year. What the recommendation will be made? Will there be budgetary allowances for that? But the chair, Dr. Vincent, made it very clear that the treasury is already budgeted for any incidentals in terms of the implementation of that, what the job evaluation would look like. So he articulated very well in terms of looking at what are the aspects that we are looking at, and I think the overall theme is to actually have staff that is fit for purpose and that will be able to work in terms of acquiring our Vision 2030. And that is basically maybe the important takeaways from this. And staff have opportunity to ask questions and get answers, clarifications. Because sometimes questions that people have is just because of lack of knowledge. There was also emphasis on the compact, which is our trademark document as a country and as a Ministry of Health and Child Care, which looks at how do we work through to achieve Vision 2030. And the aim is really to double our workforce by 2030 so that we can be able to provide the quality, affordable, accessible health that is required. As you all know that a healthy community lives longer, produces more, and saves more.
Grading is very key, it's very important. The health system is changing, there's expansion, there's growth going on in the country as far as the health sector is concerned. For example, you find 10, 20 years ago there were no specialists at this hospital. Now we have got 12 specialists at Victoria Chiteko Hospital, and with that comes in support system. Regrading of posts will help enhance that functionality and that progress as we advance and take the health system from one level to another. So we appreciate this regrading process as it is happening, and we look forward to it because it will motivate our staff and hence facilitate effective service provision to the public.